this is where I just want to focus today. I think to begin, or as a point of departure, I just want to highlight the issue that we almost have forgotten. This is about the disparity in distribution of global resources in health. This issue was very important in the beginning of this century, and the global resources are how the global resources are being distributed across the globe, across the countries. This was very important agenda in the beginning of this century. Again, I just want to repeat it. This was perceived by the global community of the researchers that 90% of the global resources was being used or being spent or invested in health research of the problems that 10% of the world population were suffering from. And only the 10% of the global resources was used in health research of the problems that 90% of the world population were suffering. And this gap was known as 1090 gap. And to address this 1090 gap, a very special organization was established back in 2005 or 2006 called Global Forum for Health Research. And the Global Forum for Health Research announced that there should be very ethical and very logical and justifiable distribution of global resources in health research around the world. And Global Forum for Health Research claimed to maintain, to attain poverty, equity, and justice through the health. And today we are so happy that this 24th Fercap conference has set a theme of maximizing benefits through responsible conduction of health research. But this is extremely important when you talk about the benefit, whom benefit we are talking about. Therefore, this disparity in global resources in health was this was very much supported by World Health Organization, and it was really, really well established. But unfortunately, now this issue has been collapsed. And the Global Forum for Health Research is collapsed. It's pushed in the shadow, and we do not know what gap is existing today. And we do not know what kind of distribution is taking place of the global resources in health research. But I'm confident that the 1090 gap exists even today. And this is a time for health research to renounce the equitable distribution of global resources in health. Otherwise, when we talk about the capacity building, it's extremely difficult how we build our capacity without the resources. And we know that the country like ours, country like Nepal, will not be able to fund sufficiently in health research. And we are very much dependent on the global resources, and the global resources must be equitably and justifiably distributed in health research. This is what I just want to mention. And now, as ethics, I think when you talk about the research, yes, the researchers have definitely contributed a lot to improve the health status of different countries, including Nepal. And now, when you talk about the ethics in health research, I would like to mention just 2 points which are very much focusing to Nepal, and I'm sure that these points are relevant to many other countries. The one point is, this is about the disparity in health status of the people. In Nepal, if you look at the average progress of the country, I think Nepal has done tremendous progress in health. And many health indicators have been improved. And this improvement, this achievement has not only been appreciated within the country, but also appreciated in international community as well. Because we have reduced the maternal mortality rate, we have reduced child mortality rate, we have reduced the morbidity, and we have prolonged our life expectancy to the extent. If you look at the life expectancy, maybe if you compare with the 50 years back, it's amazingly we have improved life expectancy. And the question is, of course, this national gross average improvement has already pushed the real status of health of population in the country. I just want to give one example. There are so many examples of the disparity of health status in the country. The one example I just want to give, infant mortality rate. If you compare the infant mortality rate over the 3 decades in Nepal, it has been reduced so tremendously. I mean, we were very happy. We feel proud of reducing infant mortality rate in the country. Because infant mortality rate in 1996, we had more than 90 per thousand live births. But today, we have reduced to in around 20 per thousand live births. If we compare with 2016, it was 28 per thousand live births. I think this reduction is tremendous, and it's very inspiring for us. But it's not enough just to see the average reduction of infant mortality rate in the country. If you look at the disparity in infant mortality rate among the people living in different parts of the world, in different parts of the country, and living in different status, different condition of the country, this is something that we should think very seriously. It means in 1996, when we had infant mortality rate around 90 per thousand live births, there was disparity and difference between the highest and lowest mortality, infant mortality rate, just by less than 50%, around 45-46% difference. But today, when we have reduced infant mortality rate to less than 30 per thousand live births, the disparity between the highest and the lowest infant mortality rate is around 90% in the country. It means we have reduced the gross average of infant mortality rate, but we have not been able to address the disparity among the people living in different parts of the country, living in different status. Because disparity is being increased, difference is being increased. Therefore, this is very important point as an ethical issue in health research that we have contributed. The health research has contributed to produce the different tools to reduce the infant mortality rate. But it's extremely important how these tools are equally relevant to all sectors of population in the country. It should be taken as an ethical issue in health research, because this is whole issue of equity and justice in health. And the second point I just want to very briefly is about the financial burden to the population because of the health situation in the country. I think the financial burden is extremely high in the country. And I think every 1 in 10 service users, 1 in 10 service users have experienced a catastrophic expenditure in health. This is extremely serious situation in the country. And I think it's very important that we have Professor Dr. Sivaraj Adhikari, whose research I have been using in many occasions about the financial burden because of the health expenditure. He is, as health economist, I think I feel very proud of, finding him as a vice chair, honorable vice chair of National Planning Commission, and I'm so proud of using his research findings in many occasions of my deliberations. Here I just want to say that in Nepal today, every year more than 400,000 population, which is more than 1% of the total population, are pushed below the poverty line simply because of expenditure in health. And there are a lot of people who are in the below poverty line. They could come up, but they have not been able to come up simply because of the expenditure in health. Therefore, this has been a serious issue. There are plenty of underlying causes of this expenditure, this financial burden. But one of the issues that we should seriously be thinking of for the health research is we are very much influenced by this market economic theory in health. Therefore, this is time for the health researchers to seriously consider and to displace this market economic theory in health and generate new theory of health economics, which will be based on equity and justice. And this is the ethical, due for the health research. I think we should think about it. So thank you very much. Thank you very much, sir.
Thank you so much, Professor Dr. Saradraj Anta. He is also the former member secretary of NHRC. Thank you so much for that insightful keynote speech. We very much appreciate your presence and insight as well. I kindly request all our speakers to be mindful of the time because we are having a little time barrier. Thank you so much. With this, I'd also like to inform all our guests that we have a very, very special keynote speech lined up for you, but that will be happening on the other half of the inaugural session. And now, for the inaugural remarks, I would like to invite Dr. Roshan Pokhrel, Secretary, Ministry of Health and Population. Thank you.
Thank you, Shama. Good morning, co-chairs of the session, Honorable Minister of Health and Population, Honorable Vice Chair of National Planning Commission, Member Secretary of NHRC, Dr. Pramod Joshi, Chairperson of MEC, all respected seniors and colleagues from different countries and colleagues from Nepal. Namaste and good morning. I really have nothing to say. I want to listen to what you have to say today. So I take this opportunity to welcoming you in Nepal, in Kathmandu, for this special conference which the country has hosted, and I take this opportunity to thank Fercap for all the work that has gone through, and all the Fercap members. Welcome to Nepal. My only thing is, as a techno-bureaucrat, I am a bureaucrat, a technical bureaucrat working for the government for the last 23 years, and to see, I'm not a researcher, so to see all the researchers out here, it feels I have immense gratitude, immense respect towards you. Whatever findings you give me, if we can collaborate together and make sure that as a policymaker, if I can implement that finding, that is the most important thing for me. So seeing all of you out here and with all the government officials and non-government partners sitting together at the same room for the betterment of health research, this is what we want. And thank you all for your presence out here. And this is what we want everywhere in the world. Not only researchers sitting together and giving out some inferences, or policymakers sitting together knowing exactly what to do, knowing exactly what not to do and what to do. If we can work together, and if you researchers can give us certain policy brief so that we can togetherly implement that in a ethical way, and as Professor Wanda said, in distributing it collectively throughout the country, then I think we have done our work. So thank you very much for all of you for being here, and we hope that this celebration will definitely give something for the government to make sure we have our new policies and we can implement it in the coming days. Thank you very much. Welcome to Nepal.
Thank you so much, Dr. Roshan Pokhrel, Secretary, Ministry of Health and Population, for that short inaugural remarks. Moving ahead, may I now have the pleasure of inviting Dr. Anjani Kumar Jha, Vice Chairman, Nepal Medical Education Commission, for the inaugural remarks. Thank you so much.
Thank you, Sharmaji. Namaste. Chair of this session, Honorable Minister for Health and Population, Mr. Pradeep Paudel, distinguished dignitaries, esteemed guests, experts, researchers, former chairpersons, participants from different countries in this hall, more number of foreigners are more than the Nepalese. This is really an international conference. Thank you, Dr. Pramod. As a Vice Chairperson of Medical Education Commission, it is a true honor to stand before you today at the 24th International Fercap Conference. As an immediate past chairperson of Nepal Health Research Council, I am filled with pride and gratitude to witness the continued progress and commitment to promote responsible conduct of health research, and would like to acknowledge the organizing and steering committee for hosting such a historical conference in the context of health research ethics here in Nepal. I had the privilege of serving as a chairman of Nepal Health Research Council and had a chance to contribute to the country's health research ethics. Today is a moment of great joy for me to look back on the work we did, and especially the achievement we celebrated in 2019 when Fercap accredited the NHRC Ethical Review Board. This milestone did not just happen overnight. It is the result of years of hard work, collaboration, and dedication of many people who believe the importance of evolving research ethics in Nepal. Our journey began back in 2008 when we first discussed the possibility of Fercap accreditation for the NHRC. At that time, we knew we had a long road ahead of us. There were a lot of factors to consider, strengthening our ethical review process, training researchers and review committee members, and ensuring that our research was meeting international standards. The workshop we held in 2008 was an important first step in the lobbying of Fercap accreditation. It was an opportunity for us to learn, share experiences, and understand what was needed to meet the high standards the Fercap set. At that point, we were not sure how long it would take or what the challenges would be, but we knew it was a crucial goal for the growth of health research in Nepal. And I am proud to say that after years of hard work and perseverance, in 2019, the Nepal Health Research Council was stated by Fercap. This achievement was not just a win for the NHRC, but the entire health research community in Nepal. It means that our system, process, and ethical standards since then are However, work does not end here. As we look forward, there are new challenges and new areas to focus on. The world of research is constantly evolving with a new technology and methods emerging all the time. Issues such as data privacy, process. The organization commitment to setting high standards for ethical research provides gratitude and support for countries like Nepal. As we continue to grow, we must